it's Jessica DaMassa with WTF Health, and joining me right now I have Jason Fay. He is a senior product strategist at GuideWell Connect, and for those that don't know, GuideWell Connect is one of the GuideWell family of companies, and that includes Blue Cross Blue Shield of Florida, also known as Florida Blue, and an innovation company, and some care delivery clinics and things like that, right?
Yes, we have 4 or 5 different entities underneath the GuideWell brand. I'm in the GuideWell Connect brand, so we develop technology solutions for health plans across sales, engagement, and retention.
So what is really cool, I think, about what you guys are doing is you're developing different solutions and then you're selling them to other Blues plans. So this is, to me, like, I don't know, an interesting aspect of innovation where it's like you guys are helping kind of develop new digital health applications or digital tools that can then be not only integrated into and co-developed really with your health plan, but also then sold to other health plans. So talk a little bit about that. I mean, what's the benefit, I guess, or like why go this route and not just acquire things?
Yeah, so one thing we do, because GuideWell Connect's really born from a health plan with Florida Blue, so we're able to leverage their expertise and bounce new solutions off of the SMEs and the product experts at Florida Blue as we develop our solutions for other health plans, which really gives us a different lens when we come at product development.
And what do you think the benefit of that is then?
Well, ultimately, I think we're able to deliver better technology solutions across that customer experience of sales, onboarding, member engagement, and then ultimately retention that will delight the health plan's customers, whoever that plan is.
And so why, go through the trouble of building it yourself and not just acquiring it? I mean, there's like a million little startups that do a lot of this thing that, that make claims about improving the customer journey and so on and so forth. So why go through the trouble and expense of building?
Well, I think one thing is that GuideWell Connect, we've got the expertise in-house to build these solutions, and we think that we can build a better experience for customers and ultimately delight them. And we believe that we can implement solutions that are better priced, better quality, and ultimately better experiences for the consumers and the end users.
From an innovation standpoint, I think you're talking about onboarding and customer experience and things like that, but what about the other side of a health plan participant, like the billing side and EOBs being like famously complicated to read or like not understanding how much things cost? I mean, are there any kinds of what are you guys doing in terms of looking at those types of issues and pain points for customers and innovating there? Yeah,
that's a great question, and I think really setting up front the expectation with the relationship of the customer of what they purchased, bringing in product and benefit education, collecting communication preferences so we know how to engage them and can help them when we need to. And ultimately, that's how you can engage the customer throughout the life cycle and keep them loyal to the plan.
Okay, very cool. So it's all about the plan loyalty, right?
Yeah, absolutely.
And we've had a lot of changes in health insurance in recent years with the Affordable Care Act being enacted and with Marketplace and things like that. So, how are things going, I guess, down there in GuideWell Connect and Florida Blue land?
Well, there has been, with the changes in the administration, different changes in the laws, but Florida Blue continues to have a great success in the ACA marketplaces. We're doing some really neat and innovative things in the Medicare space as well, and GuideWell Connect is there to help build new solutions to address the changing marketplace.
So do you guys do any work with outside startups at all? I was going to ask for some advice for startups that are chasing after health plans and they're chasing after these different organizations that work with health plans. Can startups work with you? And if so, what's the best way to get involved?
They absolutely can. Absolutely.
Terrible.
Probably one good feeder is our GuideWell Innovation Business Unit. They're an intake flow, and they vet different types of startups, and we've got investment department too that looks at those potential areas. So GuideWell Connect does do some of that, but I'd say probably the GuideWell Innovation Arm would be the best funnel point for some of those types of companies.
All right, your big prediction, what's going to be innovated next? What's going to be disrupted in the healthcare space?
Oh, wow, that's a big one. I like the chatbots. I know there's a lot of buzz going around them, but multi-channel bots with, closed neural networks and things that can help really simplify healthcare and get people the help that they need. I think the social determinants thing is really cool that's happening where, looking at all certain aspects of the health, not just the person, but what's going on around them and their environment. So I think that's got a big opportunity there as well.
Very cool. Jason, it was a pleasure to speak with you. Thank you so much for stopping by. Always good to hear about health plan innovation from someone who knows.
Thank you very much.
Thank you. This is Jessica DaMassa here at Health 2.0 with Jason Fay from GuideWell Connect for WTF Health. Thanks so much for joining us.